few moments. So Gary, listen, and I don't want to do it too early, but
No,
Gary's
we're not
actually.
taping it, so
I know we're not.
Hold on. I'm recording everything.
Oh, you are?
Yeah.
Oh, yeah.
But Gary's actually got a very fun podcast that he does also. So
we're live on mine. So
okay, good.
Good morning, everybody.
Yeah, hey, we're in the green room. So let's get everything up and going.
Live everywhere.
Yeah, listen, we're excited this morning. Ruta and I were just talking with Gary Stein, our guest. And let's just start out with it, Gary. One of the first advocates that I literally met in the medical cannabis space ages ago. Fraternity brother of mine, Sparty from Michigan State, Sigma Alpha Mu brother. So, and a lot of CDC experience, Ruta. And I know, as I was telling Gary about the green room, we'll get our audience building to talk about our main topic, job protections. But Gary comes out of the CDC environment, Ruta. And to the extent of our COVID discussion that we can't avoid starting the green room with today, because boy, Gary, what the heck's going on in this country? Just from an epidemiologic standpoint, I can't wait to hear your viewpoints on that as well. So we're thrilled to have you today.
Oh, thank you. Yeah, this third wave was expected and predicted way back in May. We saw the data that it was definitely going to go straight up right around the end of the fall, beginning of winter.
Perfectly predictable.
And it started up earlier. Yeah.
Right. And in your opinion, a third wave and not so much just a continuation of the original wave? Or, I mean, that's your epidemiologic, training to a certain extent that lets you see those subtleties, I would suspect. Can we contact trace? Can we contact trace at this point, Gary, or is it just too widespread? Because I don't know if you follow what goes on. Ruta had it, of course, and a pretty significant case, 2 full weeks of headache and fever. Don't let me minimize it, Ruta, because you lived it. And then her mom survived it, 99 years old, ICU, intubation, the whole bit. And intriguingly so, even though she was in the office and had contact with a lot of other people, she was really the only one that had it. Yeah, so the contact tracing is so interesting. And I know that was your thing that you did back in the HIV, AIDS world with the CDC, and that you've talked about the contact tracing on Facebook and other things. Can we even do that at this point, or is it just too widespread?
We can do it, but not for the same goals. At this point in time, we're trying to flatten the curve as opposed to eliminate it. So we are not quite at the window of opportunity to be able to totally mediate the disease, but we can at least knock it down to the point where the hospitals can take care of it. Because the hospitals will be overwhelmed, and in many states right now they already are. We have 3 or 4 states right now where 100% of all ICU beds are full, and they actually have a third room, sometimes called the pit, where basically it is a hospice.
Oh, wow. Yeah, I heard that too. I did hear that. Even at Sarasota Memorial, when I was there as an inpatient, they were taking over different floors. So they had COVID units, and they actually were moving patients into the cardiac floors and other floors. And they do have almost like a hospice related area where like they know the patients aren't going to kind of make it. They kind of get pushed off a little bit to the side there. So yeah, it's overwhelming a lot of hospitals. It really is.
Well, no, what did you send me?
It's very difficult to triage.
Yeah, it's basically a triage. Everybody's in a triage phase right now. And the ICUs were at capacity even when my mom was in, and that was already almost 3 weeks ago. They were at capacity. They were trying to move as soon as somebody got off the ventilator. They were like, get out. We don't have room for like people coming in on ventilators. So yeah, it's chaotic, and we're not at the level yet of other areas in the country that are just truly overwhelmed.
Well, you sent this to me last evening. News alert: 9 new COVID-19 deaths reported in Sarasota, Manatee on Wednesday.
Sunday they had 13.
And what we're seeing now is when you get COVID outbreak in rural communities, right? They don't have literally the resources to handle it. And that's why I think we're seeing near New York City type conditions in these smaller hospitals.
Well, they don't even
because
have
they may not even have an
they-
ICU.
Well, no, South Dakota or North Dakota, one of them said there for the whole state, I think they only had like 10 ICU beds in the whole state. So, I mean, if you have an epidemic or a pandemic like you do now, there's no way the 10 ICU units are going to cut it for an entire state. So,
and we can't avoid it in the
crazy.
green room to discuss the complicity of the administration at this point of not preparing and transitioning appropriately. These are lives at stake. And listen, I'm not going to be the one, well, I guess I am, to say where are the outbreaks now in the country. They are following the super spreader events.
well, you don't want to say I told you so, but we told you so. Like, really, it's all those states that didn't listen. Now they're masking up. Well, it's after the fact. I mean, thankfully they're at least doing something now, but they're exhausting their hospital workers and their frontliners, and I'm afraid, like, honestly, like, shout out to there was a group of ER docs that I know that just volunteered to go up to like South Dakota or something. God bless you guys. Thank you for doing that and stepping up to help another area. And I think that's the only way we're going to get through it is,
well, it's staffing.
It's
not
staffing.
just
It
beds,
is staffing. No, it's
staffing,
staffing's
the
a
whole
huge
bit.
issue, and
Sure.
not enough physicians, not enough nurses. There was an ad yesterday that came across. I'm part of National Nurses United, and they had a flash that said any ICU nurse that can volunteer and come out of retirement, they're throwing like $5,000, $10,000 at them. There's a shortage. I mean, the nurses are burnt out. They're exhausted.
It's
Everyone's
crazy.
burnt out, and just a shortage overall.
Talk
So
about
it's
PTSD.
crazy. Oh God, the whole industry.
So Gary,
is-
that's why we've actually started kind of a hashtag campaign out of here. It's called hashtag Unite to Fight, right? Because, and we have a lot of Republicans who watch our show too, and we always appeal to them. Let's all get together now that we're past.
Bless their hearts, yeah.
Past the election. No, listen, we know Ray Rodriguez has COVID and not
You can't.
easy COVID. No,
Can you?
no,
Yeah,
he
he's
does. No, it's out.
hospitalized
Oh,
right now.
yeah.
I was like, make sure it's
No,
okay.
no, that was in the press,
Oh, is it?
unfortunately.
Okay.
Gary, you saw it. How many state senators and representatives were not there for the swearing in? There was a certain number, and unfortunately, State Senator Rodriguez has COVID, hospitalized COVID, and
Yeah,
we wish
he's
him
on
well.
remdesivir.
Believe
Oh
me,
God, we don't wish
of
anybody.
course.
I always say that. Even I would.
No,
never
we
anyone
wish him
bad,
well,
no.
and thank
That's
God,
inhumane.
State Senator Gruters and Christian Ziegler, our other Republican friends, didn't come down with COVID while they were out campaigning around the state. But now let's all get together now that we're past the election and all mask up, all do social distancing, all do the hand washing that we need to do.
Yeah,
That's how
just
we're going to get ahead of
precautions.
this virus. So, unite to fight, and Gary, listen, I want to give a shout out to your show that you have with Carlos, of course, the rotation. Tell us about that. And then we'll get into the job protections, and you tell us everything that's been going on with that, because that's why you're here.
Absolutely. Well, should we start with the job protection? We go back to COVID for a second, because I could talk about COVID all day, unfortunately. There's so much to talk about there. And by the way, in your neck of the woods, the Lee County legislative delegation, over half is now down with COVID.
Wow. I didn't hear that.
So that is where we stand. And they came out of an election watch party, actually.
Oh,
Oh.
shocking.
That was the super spreader event.
Wow. But this is the thing, like, until people start believing in the science and believing in what's happening. I mean, there was somebody on CNN, I don't know if you caught it, there was an ICU nurse, and she was saying that people were literally on their deathbed, and their last words were like, they couldn't believe that this is real. Even on their deathbed, as they were dying of corona.
It has to be lung cancer. I saw it. It had to be lung cancer. It had to be something else. It couldn't be COVID.
Believe it. And it's like, how do you penetrate these people and make them really, even with the people and their families getting it, they're still like in this heavy denial of some kind. It's crazy.
It's actually more clinical than that. It's actually a clinical cognitive dissonance is where it comes down to at this point in time, where it's beyond belief right now. It's a solid, firm belief that the COVID is no worse than the flu, and so therefore what's going on with them can't possibly be happening. Although obviously it is. Obviously their O2 is down to the 80s, and obviously they're having a hard time breathing. Obviously they're having heart attacks, and those who survive obviously have kidney disease, brain function impairment, all sorts of things that are happening right now. And we have a administration that's still working on a non-vaccine related herd immunity, which in this case could be deadly because of the fact
Can
that
you talk
the people who survive do end
curious-
up with long-term effects.
I was going to ask you, what do you think now of like the Pfizer's and all of that coming out, like with the vaccines? Are you like hopeful, or like what are your thoughts on that?
I'm very hopeful, but there's issues with both vaccines, but they are both miraculous pieces of science. The problem with Pfizer right now is their particular vaccine has to be stored and transported at 70 below zero, and it dies within 45 minutes after being thawed. So that creates a huge amount of logistic problems. Now they fixed it in the Moderna one because they put the vaccine inside what is called a liposome, or a little ball of fat so that it can actually be stored in the refrigerator, kind of like the old polio vaccine. And I think that Barry remembers when we were kids, we had the polio vaccine, a little nasty drop of stuff they put on a sugar cube. That stuff had to be refrigerated before it was given out as well, within approximately 45 minutes after it was thawed. But it didn't have to go down to 70 below. But the
and two shots are required also, Gare. Two shots are required also.
3 weeks
so
apart,
there's a
like
follow-up
hepatitis
process
C.
that has to be, listen, it's going to be complicated. And that's why we need to unite so we can get together to fight this appropriately. For the life of me, I can't understand why our Republican friends can't rally around this at this particular point in time and see the inevitable, which is that, President-elect Biden and Vice President-elect Harris will be inaugurated on the 20th. But,
start handing off information.
There's no downside to that.
And just to
it's
save
saving lives. So let's unite to fight, right? So, Gary, you've been involved in the job protections. Well, let's put it this way. You've been writing bills, literally writing bills to assist our legislature in the progress in cannabis reforms and medical cannabis. Thank you. Thank you. You were one of the original pioneers. And as you know, I always like to give kudos and props to those that did work way before I entered the state. But I know now you're integrally involved in trying to get this job protection issue taken care of. So there's the setup for you. Give us the history. And listen,
and even history about himself, because a lot of viewers, I'm sure, they don't know who you are. So give us a quick bio, a 3-minute bio and background on yourself, so people know who you are.
Okay, well, first off, I did work with the Centers for Disease Control for the better part of 2 decades, back in the age of HIV, doing basically epidemiology, contact tracing for HIV, sexually transmitted diseases like syphilis, which had a major outbreak in Florida at the time that I started, as well as tuberculosis. And the whole concept was to find the people who were infected and get them treated and make certain they're isolated so they don't infect others. And that makes it easier for the rest of us to go about our lives. We don't have to worry about who's coughing next to us if we know that the person who's sick is at home or in the hospital. And that's basically what we need to do as far as that's concerned. Now, I could go on like that, but that's not exactly the topic today. I also have my master's degree in public health from Johns Hopkins over in Baltimore, which is a fine institution, which is really leading the charge right now in COVID.
Yeah, they really are for COVID.
And I retired from the CDC and then came down to Florida to run the tobacco program for Hillsborough County. And then Governor Scott decided to lay off over 2,000 public health employees, of which I was one. And it freed me to go ahead and start working on various topics that I felt were important. The first one was Medicaid expansion and to implementation of the ACA, which was a big fight in Florida. And then when that fell down, because they were stronger than we were on that one as well, that's when I took a heed and took a look at the situation with medical cannabis as being the unsung hero that needs to be pushed forward. And that was in part from meeting Kathy Jordan and seeing how an ALS patient who should have been dead in 1990 was alive in 2013 and well because of a plant. And that I found was remarkable. And that changed my whole viewpoint of cannabis. And that's when I started working on that. But we have had issues in regards to workplace relations for a while. I mean, there are people like Kathy who, if it weren't for that plant, she would not be able to do as much as she's able to do right now. In fact, there are people, a gentleman I met in 2014 who had severe Crohn's disease, who had most of his colon removed, who was in hospice, and whose wife said, well, I didn't ever want you to use cannabis, but give it a try. And actually, it went into remission after using it for a couple of months. He got strong enough. He almost redoubled his weight back to 150. He was at 76 when he was dying. And he was able to go back to work, actually handling heavy machinery, which is remarkable. But it shows the fact that we need to have workplace protections, because there are people who the only reason they are back to work is because of the fact that they have had access to a plant that took them from severe illness to healthy enough to go back to support their family and support our community and be taxpayers. And
how are the legislators looking at it? I know that you're in touch with so many. I mean, there's got to be, I think it's both sides of the aisle should be coming together on something like this. Are they not?
Not exactly. I mean, there are some Republicans who are on our favor. Mostly, it's the Democrats, but they are worried about the fact that you're going to have employees on the job who do not function as well as they should because of all the misinformation that they've gotten, that the average stoner is out there totally unable to work, unable to function properly. And it's just not the case.
Whereas we would maintain that they're better employees, quite frankly, because they're getting a better night's sleep, right? Their ailments, the Crohn's, listen, we could go through them all. But the point is, we maintain that it's a utilization and an augmentation on top of other medicines that they may be on. You know, Gary, I didn't want you to be, although you still are by far and away the most educated on all this, but I wanted Ruta and I to do a little research before. I guess there are 19 states, right?
Right.
That do have some degree of job protections, but all of them have the same thing in it. If it interferes with federal funding and a federal issue, then that supersedes, correct?
And you're talking so many jobs like hospital workers, things like that, especially community hospitals. They're federal. So if their employees get tested, they're fired. So, I mean, it's tough. It's very tough.
Right. So do you have a bill right now, Gary, that has been written, that's ready to go and prepared, left over? Yeah, I know you do. Tell us about it and you know what.
There we go.
No, we have the bill.
Yeah, the bill is ready, and basically it states that if a person is on the job and they test for whatever reasons, and that test comes up positive for cannabis, they have a few days to go ahead and verify why. Now that means that if they have a medical cannabis card, that would suffice, because you can't just say, "Oh yes, I have a medical cannabis card," and go on from there. You actually have to prove that you are using this product legally in the state of Florida, which makes perfect sense. And that person is allowed to go ahead and actually file charges against the employer if it is an unrighteous firing. And a lot of these bills in the other 19 states all go on one basis, and that is the fact that it is discriminatory to those people who are ill, to prevent them from having access to the medicine if their work performance is in line with what their job requirements are. And that's I can't emphasize that enough. People should be judged not on whether or not they have a medical card or not, but on their job performance. If their job performance suffers, then they can't. And also, we had to put it in this last year that they cannot use on the job. There's a time and a place for everything. So for those folks who utilize it outside of work, off duty, that kind of situation, there is not a problem. That said, we still have people who are working right next to folks who are using opioids right now, and their employers are letting them get away with that.
Right. And it's always about impairment, Gary, and that's always been the difficult issue with cannabis, is that it stays in a urine drug screen for at least 30 days, maybe 60 days, maybe 90 days. You know, it's hard to say. And that measure of impairment, even with driving, and you and I have had this discussion, of course, as well, you know, there's not really a nanogram amount per se in the bloodstream or absolutely in the urine, you know, that connotes impairment, you know, and that's always the issue. Alcohol, of course, has its levels with typically correlate with a certain amount of impairment, you know. So it's a different, you know, substance. So, and listen, I always tell my patients, I want to know the anesthesiologist that's taking an Ambien and having 2 glasses of wine at 10 o'clock to go to sleep, who's coming in and doing my anesthesia at 6:30 in the morning, right? Because I guarantee you his measure of impairment, I would suspect would be far beyond, that physician that may use cannabis. Also complicating things to the extent of use in the workplace and all that, Gary, it's interesting because now you have your patches, right? And you have your, ingestible products that you can take in the morning, with your coffee or your tea, and you're going to have THC in your bloodstream during the day, but that may, quite frankly, add to your focus at your job and or ameliorate your pain, or your anxiety level. So it's just not so easy. And that's why it connotes logical discussion amongst the leaders in the state, the physician leaders, the politicians, business leaders as well, right? So Publix, for example, and listen, I'm not going to call them out specifically, but we, I'm not going to call
As I say it.
As I say it. Listen, that is pretty funny. Sorry. Why I do that, I don't know. But anyway, listen, we know there's companies, let's put it this way, and we have employees in many different companies that have a tacit agreement to a certain extent amongst management that if you have a good employee and they get caught in a random drug test, that good employee can bring in their card and the manager has the right to say, you know what, you're a great employee. Sorry you got caught in this, whatever, right? So the use of the card is important, Gary. And I know it's one of those things that we talk about that as we go forward with legal adult use, when it happens, not if, when, we don't know when, but it will happen ultimately in Florida, 2 years, 4 years, 6 years, 10 years, who knows? But when it does, will there be job protections for everybody or just those that hold a medical card, right? Can we keep our taxes at zero, right, in the medical program? Can we guarantee the quality of product in the medical program? But that job protections is a critical issue. And I say we're going to fight like heck to get it, Gary, every year, and surely this year as well. But I look at it as one of those 3 to 5 year processes, unfortunately, in Florida. Let's talk about the legislative side. We have Chris Sprouse, who was just, obviously put in as Speaker of the House. And Senator Simpson will be, chairing leading the Senate. Did Gil Harrell get the health committee leadership in the Senate yet? Do we know that?
They have not gotten that part. Just 2 days ago, they swore everybody in. And
so it's going to be tough sledding. It's going to be tough sledding up there. And as much as we want job protections, and I want to give a shout out to Josephine Cornella Creel, who I know is watching, because there's advocates all over the state that want this, and we're going to fight hard, okay? But I just don't see it happening this year, It doesn't mean we're not going to fight for it, but it's going to be tough sledding up there.
Yeah, that's the way it is with a lot of legislation. You've got to keep going after it year after year and never skip one, because therefore you lose that inertia that goes on as something becomes normalized as far as legislation is concerned. And we do have a lot of issues this next legislation. Sprouse is very much a law and order person. He's the son of a police officer. And last year and the year before, he brought on Bertha Madras and Mr. Berenson over from the New York Times to talk about how reefer madness is really the real thing. And of course, we have to debate that, unfortunately, with the guy who thought he was so great that he contacted them and paid for them to come over and speak to the representatives. So that's him. But there is options. One of the things I have in the bill this year is an amendment that allows for a study to show whether first responders who are using the product off duty and off the clock are still good at their job and still able to go ahead and perform, because we do have a massive PTSD issue with first responders. Just in the Hillsborough County area last year, we had a gentleman who was a resource officer who retired because of PTSD, and he was brought back on after the situation over in Broward County with the school shooting. And he lost it and ended up going home and shooting his grandkids and himself. And we have had people who have committed suicide who are firemen, and people who are first responders as far as EMS is concerned. These people have severe PTSD issues. And I have talked to several sheriffs, and they say, it's a no-go because we're afraid it's going to affect their performance. So let's have a study. let's see
Agree.
if
I
these
think
people
studies are
can
needed.
study.
It is important to have the studies. One of the things that I wanted to ask you, maybe that you can give your insight. We were actually having this discussion in the office, like if medical marijuana or all marijuana goes federal, how is it going to be affected, like if they deschedule or change the scheduling of it, as far as even dispensing and then going through FDA trials and things? Are they going to go through all those hoops and loops to get it approved, do you think, if it goes on a federal level for mass consumption?
I have issues with rescheduling as opposed to descheduling, because therefore it puts it squarely in the hands of big pharma to go ahead and play with. And they might just drive the price up and all sorts of things that there are issues in regards to that. Now, as far as how it goes legal federally, there's a number of legislative ways they can do it. And the MORE Act is a good one, because it does allow for people to gauge their policy on a federal level as well as state level, and expunge those people who have been hurt by it in the past. But it all depends also who's going to be on the FDA and who's going to be working the DEA as well, and how they view it, and whether or not it's deemed medical, or whether they're talking about adult use across the country, because that brings up other issues. Here we're talking about a employee protection right, which basically states that if a person is using it for medical reasons, then they should be able to use it. That really doesn't pertain to the adult use issue.
How
It
do
really
you get
doesn't.
around though? How do you get around, like for Florida, it's an at-will state. So an employer can terminate it without cause at any time. So is that one of the holdups because it is an at-will state?
It is. It is. I mean, you basically serve at the pleasure of your supervisor, and therefore they have the right to go ahead and fire you at will. This bill puts a protection in place saying, if you are a person who requires this medicine, you have a disability, and officially you are denying him what he needs in order to survive, or just to work properly. He needs to have workforce accommodations. That's basically what is necessary. They're saying if a person is disabled, they need medicine, then an accommodation should be there so they can use it on the off hours, so they can come to work healthy and be productive. And in fact, statistics have shown that oftentimes people who come back to work when they're using cannabis are actually better at their job than they had been before. In some instances, it has to do with the fact that people whose minds go too fast, like the folks who have autism, if it slows them down enough, they actually are better workers. I can tell you that my daughter is actually a better driver now that she's been using it for her pain. And I should mention the fact that my daughter was also a person who was hit with the employee protection issue. Barry knows her. She's been in his office. She actually was fired from her job because of the fact that she was at a traffic light during a lunch and was hit by another car. And with all the torque and all that bit, she had to go get examined. And by law, because of employee compensation rules, she had to get tested. And she said, well, just so you know, I've already told you before, I have a medical card. And they said, all right, well, we're going to test you anyway and see what happens. Well, she hadn't used since Sunday because she used it for severe back pain. And now she has a car accident, which she's going to need even more. But she tested positive on Wednesday and negative on Thursday. And on Friday, they said, well, here's what we've decided we're going to do. You're going to cut up your medical card in front of us and promise that you're never going to use again. And we have the right to test you at any time.
Wow.
Well, no, that's one of the countless, and that's one of the countless stories, Billy Cox, friend who, writes for the, Sarasota Herald Tribune. He's doing a story on the job protection issues. He asked me how many cases. And I said, Billy, there are countless cases, and every medical card holder lives with the daily fear, right, of the effects that holding that card and their use of medical cannabis may have. So I thank you, Gary, for your activism,
very much.
not only on this issue, but on every issue. Listen, I want to give you a quick 30 seconds. Tell us about Suncoast Normal and the rotation. You guys had an interview with Joe Redner. Listen, if anybody didn't watch the rotation this past weekend with the interview with Joe Redner, good friend, cannabis advocate, literally said on your rotation that he wants to take a cannabis plant that he's growing and put it on the desk of the DA in Hillsborough or wherever county he is and say, here, listen, here's my plant. Take me to court, please. And I can see Joe doing that. But what a great hour that was, Garrett. Anyone that hasn't seen it, go back and watch it. Give us a quick plug for what you're up to, man.
Yeah, Joe is a real firecracker. He's 80 years old. He is
80 years old.
Wow.
He is a survivor of stage 4 lung cancer, strictly because he's been using the plant by utilizing the THCA, taking the raw plant, throwing it into the blender, making it to a smoothie and knocking it down every morning. And that is how he has survived cancer, and that's how he is continuing to fight for us. And that is why he had that home grow bill that Barry, I got you involved in as his doctor, so that they could go ahead and go to court on this. And of course, after a long battle, after we won in the district courts and had some issues in regards to the Court of Appeals, that we unfortunately lost that one. But I do have another home grow bill that's coming up for this next session. But he's still fighting with on the Flora grown case, where he wanted to go ahead and start up a dispensary. And he also was trying to verify the fact that we don't have to have vertical integration as a mandate. So he's continuing to fight. I would highly recommend you take a look at the show. He's a great person to do. Of course, he kind of negates those FCC standards with a few F-bombs that he throws in from time to time. But he's a great person to interview. And for those people who have some time on Sunday morning at 10:30, you can go to suncoastnormal.org and watch it there on the Facebook page. And we cover all the topics when it comes to cannabis is concerned. Everything from the bills for home grow, for employee protection, for institutional protection. So if you're in the hospital, they can't take away your medicine. There was a lady who was using this for Parkinson's, and when she went into a nursing home, they took away her medicine because they said, well, we do Medicare over here, and so we can't let you have your medicine. And she went downhill and was dead within a matter of about a month.
And listen, Gary, this is why you're the warrior that you are, that I love having you on always. And listen, we do support Normal, Suncoast Normal, of course, being our local. Carlos and you do a great job. Shout out to all you guys. And, we'll see you both virtually, and, we'll give the elbow knocks with a mask when that's appropriate too. But thanks for all the updates, Ben.
Yeah,
no problem. There's a lot to come.
Oh, good.
Listen, we
We'll
could have
have you back
had an
on.
hour green room today, but listen, we like to keep them quick and informative and entertaining. Everybody, thanks for joining us. Ruta, as always.
And thank you, Gary. Great job, really. Thank you.
Have a great day,
problem.
everybody.
Bye, everyone.